Welcome to the We Talk Health Podcast, the official podcast for West Tennessee Healthcare. Please be advised that this podcast is not intended to replace any medical advice. Always follow your medical professional's advice and direction. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions, please reach out to us at wetalkhealthpodcast@gmail.com, and we will do our best to answer any questions you may have.
Welcome to another episode of We Talk Health. My name is will.kwasigroh, and I'm here today with the Butterflies Embrace Perinatal Bereavement team, and we are going to be talking about bereavement care. So with me today is marybeth.dunagan. Marybeth is the Perinatal Bereavement Counselor and the Community Liaison. Rachel.Ryan, who's also joining us today, she is the Certified Child Life Specialist, and LeighAnn Sutton, who is a Perinatal Bereavement Coordinator. How are y'all this morning?
We're good.
Well.
We're great. Thank you.
Thank y'all for coming in.
Thank you.
So today we're going to be talking about the specific part of their program that has to deal with bereavement care. Bereavement care is a specialized type of care to support people who are grieving. And that is mainly what Marybeth and Rachel deal with, is families who have lost children, and it's usually the post-care. Is that correct?
Mm-hmm.
Okay. LeighAnn, how about you just kind of dive into
Sure.
specifics?
So first of all, probably need to explain why bereavement care is so important. When we're training staff, when we're talking with physicians, I always try to make that emphasized. Why is bereavement care so important? Because when a family is actually in the hospital at the point of delivery and the few days after that, we really focus on trying to create, some positive time, explaining that they need to love each other and support each other as a family. And so we start focusing not just on mom and dad at that time, we begin to focus on the entire family. So that's why Rachel's so important. That's why Marybeth is so important. And so that kind of leads us into a conversation about what is bereavement care and why do we focus on that so much? Why do we not just stop caring for a family when they leave the hospital? And it's really because the needs continue. There are so many things that can happen in a family's life after a tragedy, after a trauma. And so we really want to make sure that they have the support they need. And that's where Marybeth and Rachel are so influential in kind of guiding them through conversations, not only about their children, but about how a family could cope together and what are risk factors and what are things that we could, help with, what are resources that we have available in our community. So Marybeth, tell us just a little bit about what are some of the things that we see typically that are red flags for us when a family leaves the hospital? What do we look for to make sure they're coping well?
One of the things that we do after a family leaves the hospital is we contact within that first week after they leave. And then within that first month, we will send them a Edinburgh screening tool that kind of scales the level of depression, anxiety that they are going through. And we did talk about that a little bit on our last podcast about how, we make sure that each family has their own specialized care and plan, and every plan is different for each family.
Right.
So if the woman is married or has a partner, or if she has children, all the different things come into play. So that's where Rachel comes in. If they have children, we just kind of assess all of the needs. One thing that we do see whenever they leave the hospital is kind of depending on at what time of the loss it was, also depends on the need of the mama.
Right.
So if it was a very early on in the pregnancy loss, those moms need things that are different than women who lost full-term
Exactly.
babies.
Which is the reason that we don't focus on just a certain gestational age frame. We focus on every gestational age, whether that be an early loss that comes in through the ED or through an OB clinic, all the way through a full-term loss or even a tragic SIDS death after, the family has went home. So there are so many different types of grief just in that conversation, and we have to assess that, and we have to figure out what the family is going through at what particular stage they're at.
Yeah. So that's another thing is doing that, and we call it the EPDS that we do in our first home visit that we do virtually or in the home. We talk a lot about their score, which is a scale of 0 to 30, and we talk about their score. From there, we go on and either refer to counseling or follow up with their OB doctor to discuss if there's any type of anxiety, depression meds that need to be given, med management,
Right.
counseling, all that stuff.
And that's really a tough conversation. I mean,
Oh, yeah.
most families, especially the mom, her hormones are already in just complete imbalance. And then you add anxiety and depression on top of that. So most moms automatically say what to us? I really don't think I need medication.
Right.
And we have to sometimes say, it's really okay for you to take care of yourself now. Like, no one's going to do this but you, and you have to figure out your own way, whether that be through medication or with additional therapy or with more frequent visits from you.
Yeah. And so another thing that I have noticed is that women who sometimes, most of the time, decline the medicine or think they don't need the medicine are women who have other children in the home.
And that's very, understandable. They don't want to be in a fog.
Right.
They don't want to not feel or not be able to be happy with their other children. And they're really scared about that because that's what society has told them, that these medicines are going to change them, their personality. And we have to, really address that. I've heard you talk with moms many times, and you've explained that it will give you a way to manage it differently.
Oh, yeah.
It will not change you.
Right.
You'll still have the feelings, but it will give you a better way to manage those feelings and help your children learn how to manage their feelings as well.
Sometimes another way that I've talked about it with people who have other children in the home is that it helps you to take care of your other children. If you have a medication that can just get you through the day, it doesn't have to be a large dose, but just
Right.
something that,
Right.
like you say, takes the edge off. And sometimes when they have other children in the home and then they're trying to grieve, take care of themselves, those other children see the worst of Mama in those few weeks months after she can leave the hospital. So it's all about taking care of yourself,
Right.
which we talk about a lot. Is self-care. Another thing is, this goes back to specialized plan per patient, is mamas who have seen a counselor, it doesn't work, but they still don't want to take medication, is we have researched every natural type of way to
Try to find different ways.
for these mamas to help with their grief. So we've gone as far as, there's a flotation therapy center right here in Jackson that a lot of people don't know about.
Exactly.
That just floating on water can just ease those anxieties.
And a lot of times we don't push one way or the other. We don't
Right.
say every family needs to consider medication. Every family needs to consider therapy. But we use that kind of analogy that in conjunction, in collaboration together, these are some of the things that we know will help you. And doesn't have to be long term. Doesn't have to be, for a long period of your life. But once you put yourself out there to figuring out what's going to work for you, you'll begin to see the differences that it can make in your life. And so we don't push either way, but we offer so many different alternatives that families may not realize that we have here in our community.
Oh, yeah. I mean, we have lots of great resources. You have lots of
We
great
do.
connections with counselors from Memphis to Union City and everywhere in between. You
Everywhere
have
in between.
connections to lots of great, whether the mom wants to go by herself or she wants to go with her spouse and her partner and have couples therapy. I think that goes back to when the first time I do talk to the mom, whether it be on the phone or in person, I always ask how dad is.
And that's so important. We've talked about in other podcasts why the differences between men and women grieving they're so important to recognize. And it's hard for us to describe those when you're in the midst of it. So kind of when you get perspective, when you maybe use some medication or an alternative therapy or actually going into counseling, you can kind of put those feelings into perspective. I'm grieving, my husband's grieving, my kids are grieving, and we all have to figure out ways that we're going to do this together
Yeah.
to work through that.
I can talk a lot about husband and wife
Exactly.
grieving, but one thing that I am very biased to is the children grieving too. So, Rachel, if you have any.
Yeah, I'm just sitting here listening to you all talk about the whole family, and a lot of times we miss during that moment of grief, that sudden information of we're not going to have a baby to take home, is what about the other kids? And, sometimes we forget about the little ones because we think they won't understand.
Right.
And while that could be true of certain ages, they may not get it. They may not grasp it. They will grow and they will have questions.
Yeah.
And they're continuing to grow. They're figuring out the world around them. Their brain is still developing. And you're talking about moms and how they're handling their grief. I always talk to kids about how the brain is the boss of your body. The brain tells us what to say. The brain tells us when to eat. The brain tells us how we feel. And so if we're not getting that mental help that we need, we're not doing justice to the rest of our lives.
No,
and,
not at all.
And people around us. And so I think the society thinks that makes you weak when you ask for help and getting that mental help, when really that's the best thing you can do, because the brain is the boss. And so just, with siblings, mom goes home, dad goes to work. Maybe mom's getting ready to go back to work. They get back into that phase of doing and taking care and sometimes busyness. And having the kids there can be a trigger for some families when there's siblings in the home, because they may be asking questions or bringing up that my baby brother has died. And when they say things like that, that can hurt. That can hurt a mom. That can hurt a dad. That brings those feelings back up again when they think, man, I was doing so well. Until they said that. And so many times, if I have the opportunity to talk to mom and dad in the hospital, I will tell them there will be moments where they will say things or ask questions, and it's going to be hard. And you'll think, gosh, I thought I was doing so great. And so
I thought we'd already answered that question.
Yeah, we already talked about that. And don't get mad because, we say, what's the number one question that even adults, we say the number one question is when we don't understand things, we say, why?
Wow.
Why this? Why that? And kids, that's their favorite thing to ask also, because they are trying to understand. Repeating the same questions is a common theme. And so I just encourage parents to continue to answer the same way every single time. There may be more information that you can give them as time rolls on, but most of the time it's going to be the same answer. And they need that. They need that stability. They need that answer, even if it's an I don't know, but I'm sad too. Or I don't know, but I'm mad too. They need that. So don't brush it off. And I always tell moms and dads too, if you can't answer that question, if it is just not your day, because there will be days like that where it's just not your day, take that break. And who is somebody else in your family that can be that support for you? Is it your mom or your dad or an aunt or a sister or a friend, whoever? Take that time out and say, I need your help today. They've got some questions, or I'm just at my wit's end. I just can't do it today. Can you help me? And so kind of distinguishing who are those people in your life that can be that help for you. And unfortunately, there are families that don't have those kinds of people.
And that's something that Marybeth and I have talked about is we try to bring awareness to the family as much as we can. If we've met them earlier in the pregnancy, before the loss has actually occurred, or if it's just at the time of delivery that the child has died, we try to help them become more aware of what their options are, what their resources are, like in their community, what social support systems do they already have in place. So we kind of create like an afterbirth plan in a sense to help them understand that even though you don't have that baby with you, your needs are still the same. You're still going to be stressed. You're still going to have moments of just uncontrollable emotion, even more so at that time. Your kids are still going to have their needs, their ball games, their schoolwork, those things. And so we try to help them understand you're going to need help.
Some of these moms, their bodies are still responding. They just had a baby.
Exactly.
Oh, yeah.
And
Physically, they may not be able to do things.
Yeah. And so they have that physical reminder, but there's no baby there.
Right.
And that can be tough. And I know, like, a lot of times you talk about, even in the, if you're at the grocery store, you may still look like you've had a baby or are pregnant or whatever it is. And so people may ask questions like, how's the baby, or that kind of thing. And those are triggers. And so, I think our crew does a great job of showing those what if moments.
Right.
It doesn't mean that it's going to make it easier necessarily, but it just it means that we're trying to take care of them and be forward thinking for them because they can't do that at that moment.
Right.
It's kind of one of my, right before I do talk to them before their 6-week mark, where I know they're going to be going back in for their postpartum appointment. And I tell them every time, I just want to warn you, like, this postpartum appointment, it's going to be a trigger. You're going to be sitting in the waiting room with other pregnant women who are waiting on their just a regular prenatal visit. And it's going to be hard for you because this was the appointment that either you were going to take your baby and show them off to your OB, or a lot of times at the 6-week mark, you're also taking your baby to their pediatrician. So at my clinic, for a child, you may go to your OB appointment and walk straight across and do your pediatric appointment the same day. It's one of those things that it's a huge trigger, that appointment that's like, okay, we'll see you next year, So I always tell them, I think them knowing, and a lot of times they are like, oh yeah, I didn't even think about that. And so not being surprised whenever they do go in and having to sit back in a waiting room with other pregnant women, or sitting in the OB clinic in their patient room even, can be emotional because
just a few weeks prior they were sitting there and they were pregnant.
Yeah, just a few weeks prior they were sitting there pregnant and able to hear something on the Doppler or an NST or anything like that. So being around all of that is just a huge trigger. So I always try to at least give a little bit of warning so that they know. We have, LeighAnn, I know you have in the past, that if you do know that a mom absolutely cannot handle it, we do have a few OBs here that have kind of let them slide in the back door.
Exactly.
So they don't have to sit in the waiting room. Yeah. So that is one of the things that by the time you hit that 4 to 6 week mark, we're going to know, like, you're severely high risk. You do not need to be placed in a waiting room. So that is one of the big things that I always say it. I keep saying it, just specialized plan.
Yeah. And that's why bereavement care is so important, because we're trying to help them work through scenarios that they don't even have awareness of yet. That fog of being not only sleep deprived, but also the physical pain, now the emotional pain. And grief itself just creates a fog in your brain where you can't process information. And so for someone else to be able to share, this is probably what you're going to see or experience, or the people around you, you're going to have to work through this too. That fog sometimes prevents you from making good decisions. And so that person might have went to their OB clinic, never thought about it, and all of a sudden they're in the middle of the room and they're uncontrollable sobbing. So if you can prepare them for that and find a way, okay, so the nurse is going to come get you in the parking lot. They're going to go in the back door. You'll never see anyone else in the waiting room. You won't be on the same hallway as the peds department, so you won't hear babies crying. Right. Or you won't hear that mom having a Doppler with the heartbeat loud and clear. So if we can just kind of lift that fog a little bit, it helps the mom to see there are a lot of things that we have the ability to help with, and that they trust us. Then they begin to let us work through those problems with them, and that's all we want. We just want to help. We just want to support. I think that's important too, why we have that good connection with the OB clinics in our in our area, because there are times that, once again, depending on their EPDS score, we send it to their OB. And I've talked to a couple of OBs in the last few weeks that I've been able to say, hey, I know you have a really good relationship with this patient, and maybe you can talk to them and help us out in supporting us in the decision. We obviously cannot prescribe the medication. Right. So we're only suggesting it, and letting them know that, hey, we have suggested this. She may be contacting you in the next couple of days to talk about being put on a medication. So I just want you to know it's coming more from us than it is she woke up this morning and decided she needed a medication. So they're always, the ones that I've talked to just in the last couple of weeks, they're like, oh, thank you so much. I tried that at her postpartum appointment. She did not agree to it, so thank you for talking to her again. Exactly. So them knowing that we're here to support them, and then them supporting us it's so important. It's so important. Yeah. And so something else that we haven't really focused on a lot is what services afterwards do we have for kids? I mean, a lot of times, like you mentioned before, the kids might not be on the top priority list because mom and dad have so many things on their plate when they leave the hospital, but kids need to have stability. They need to have things in place to help them because we're building a foundation for them to learn how to deal with life and stress and heightened emotion states, anxieties, fears. And so we need those resources in place, and we have so many in this area. So maybe tell us a little bit more about those, Rachel, and tell us how we put those in place for families.
Yeah, so my goal is for the families as much as possible, even if I'm not physically present, we're all working together to make sure they don't leave here without something.
Without resources.
In their hand for their kids. And so if I've had that chance to talk with them, of course that helps, and preparing them on what to say. And
it's so helpful.
Yeah, and a lot of parents struggle with, what if I say the wrong thing? And they think they're just going to destroy their kid.
It's a one-time shot.
Yeah. And so we talk a lot about you're coming, and you are as a parent, if you're coming from a place of love, you're never going to say the wrong thing. And you're always going to have the opportunity to make it right.
Exactly.
And so just because, and again, that's just the circle of care as a parent, is that there's going to be more opportunities that come up. And so it's not a one-time shot. And you learn, parents learn, they may think, man, I didn't feel good about that.
Yeah, I didn't like that conversation we just had.
Yeah. But again, kids will let you know how much they need, and it will change. So we do have resources in the community, and I feel like, there's never enough. There's just
That's
never
true.
enough. But
We want more.
Yeah. But and kids are it's so critical for kids because, they're just continuing to grow. And so, we have places that offer music therapy and art therapy, and we have great connections with them. And I think for a kid and for parents too, sometimes those options feel better than say, I'm going to put my kid in therapy with a counselor.
Right.
And
it's a bridge for us to use to help the whole family get into counseling too. Like help. They think
if you're
helping
helping your
the child, but really it's helping the parents too.
Yeah. And so there's those opportunities for kids. They having a kid in their natural state of play, of music, whatever it is, can open up opportunities for feelings without them really even realizing what they're doing.
Yeah.
And so we have connections with places like that. And we've even, I was trying to think of some other things. We've even had kids get into some jiu-jitsu programs, like learning about jiu-jitsu. And, it is specialized according to what every parent, what every family needs. We can talk a lot about these are the things we do, but it doesn't mean we do that for every family.
Right.
And that's why bereavement care is so important, because Marybeth, you and LeighAnn, you are talking to the families and learning those needs as they go along. And so, again, it's going to change.
Right.
So, sometimes you have to get creative with it. But I think the biggest encouragement I try to really give to parents is you're their parent. Like you are their guide. You got this. Like you are teaching them about grief. They are learning from you. And so just equipping them with courage is a big thing. But we do give them physical resources as well.
Yeah.
Well, this has been a lot of great information for people to understand that if you're feeling alone in these moments, we have a great team here who's going to make it their mission to make sure you feel better. Obviously, losing a child is a very hard thing to go through. I can't speak from personal experience, but I know these guys here really do a great job of helping families get through this difficult time. If you ever have any questions for them specifically, their email addresses are going to be under their names in the description of the podcast. There's a link to WTH.org that will take you to a specific page about their services. If you ever have any other questions, feel free to email us at wetalkhealthpodcast@gmail.com. This has been another episode of We Talk Health.